Certainly, glioblastoma is the most common type of cancer that arises in the brain in adult patients. There are about 13,000 cases diagnosed in the United States each year. It's a cancer that can happen at any age, but it does increase in frequency as we get older. So the average patient is in their 6th to 7th decade of life. 11,000 to 12,000 patients die every year from glioblastoma. It is an aggressive type of cancer. It is a cancer that, for reasons that have not been explained, does not tend to metastasize in the body. And that's a good thing, of course, but what it does to make up for that capability is that it can infiltrate and spread into the adjacent brain very efficiently and very effectively. There are several factors that make this type of cancer difficult to treat. First of all, arising in the brain, a critical organ of our body, makes it very challenging to be able to target and focus therapy safely and effectively without damaging the adjacent brain tissue. We have treatments that are effective and that can help our patients. The problem is the durability of that benefit, and ultimately some of the tumor cells are able to persevere, mutate, and adapt and become resistant, so the durability of the treatment, unfortunately, for most patients is not long-lasting. The survival rate with glioblastoma, when we look at the averages of all patients who were diagnosed, is approximately 15 to 18 months from the date of diagnosis. But we do have, I think, a growing number of patients who are 3 years or 5 years or even 5 to 10 years who are doing well without tumor recurrence. So those percentages are small, but I think they are growing. And I think because the tumor can microscopically infiltrate, surgery is not curative. But removing the main mass or the bulk of the tumor does improve the likelihood that patients are going to do well and respond better in the long run. So I think he's in that good situation, fortunately. Other treatment designed to kill those cells and to prevent them from growing is always required for this disease, and that typically involves a combination of radiation therapy as well as chemotherapy. So my hope and what our experience has been with other patients, particularly if they've had a relatively small peripheral tumor that's been able to be successfully resected, that phase of the treatment they're able to do very well and tolerate quite well. Knowing Senator McCain's history, what he's dealt with, his fortitude, what he's overcome, I have no doubt he's going to make his way back into his office in as quick a time as possible.